But the last act of this morning for me is to introduce the CEO of The Cure, the building that we are fortunate enough to be in. And she is going to have a quick 5 minutes to explain what The Cure is all about, what they do here, how you can get involved. So Seema, please come up.
Thank you, Bladlin. Really appreciate it. And first of all, good afternoon and welcome to our wonderful building, Cure. And I know you must have had a really stimulating and exciting morning discussing, how data and digital are going to impact all of us in our everyday lives. I'm just going to see if this thing can go down a little. Is there a way that this goes down? No. Okay. So first of all, I just want to say it's a pleasure to be hosting you all here, and I hope you've had a stimulating morning. You must all be wondering, what is Cure all about? What is this building that you're having this conference in? And so I wanted to take a few minutes to tell you a little bit about Cure. So Cure is really, we call ourselves an innovation campus, and that's where you are. It is purpose-built to enable collaboration across disciplines, across sectors, between industry, academia, non-for-profit, and for-profit entities, with really one purpose and one purpose only, and that is to advance healthcare and find cures. Cure, period. And so that is our mission. It's very simple. It's in our logo, and as you can see, that's why there is a period after our logo, which is, at the end of the day, we want to cure. Period. So what do we do in this building? In this building, we have 21 residents. They call the Cure building their home. They are involved in all kinds of work. There is everything from drug discovery and development, all the way to a medical incubator, medical devices incubator that incubates pediatric devices that do not have any commercial potential. And so they would be discarded, but we would take them up here and incubate them and bring them to market. So that's sort of the non-for-profit aspect of our organization that lives here called Advancium. We also have a floor that is fully dedicated to gene therapy, one company that's working on gene therapy for Alzheimer's disease and cardiovascular disease, another company similarly on CNS, but using a platform that's across multiple diseases. There's another company that works on human breast milk protein and making that so that in the future, perhaps one day, when we once again face those baby food shortages, that we're not faced in the same situation that we were in last year, and so on and such forth. We also have this education center, which is really a place where we convene dialogues, and our reach and our conversations like today's conversation go beyond our walls, because at the end of the day, what we want to do is to curate dialogue, conversations, events that push the boundaries of thinking of how we can transform healthcare and find cures. So that's all about Cure. And one last thing I wanted to mention is what you see on the slide up here, and that is the new innovation challenge that we have just announced. We all know, AI is all the buzz, digital is all the buzz. I think that there is sort of a dual reaction to AI. On the one hand, there is a lot of high hopes for what it can do to solve lots of different things for human beings, but also what it can do for healthcare. On the other hand, there is valid concerns about about AI and needing to do it responsibly and ensuring that we're taking into consideration social, legal, ethical implications of AI and putting some governance around it. And data, as we all know, is really what AI is all about. Without good data, without data integrity, without data accuracy, without powered data, we wouldn't have AI. And the AI is only as good as the data and what we teach it to do. So what we want to do is, we know that actually the people who are most able to kind of look at the leverage that AI can bring to healthcare are today's entrepreneurs who are living in the digital age. And so we are calling on all entrepreneurs and throwing out the challenge to bring forward bold ideas and innovations to take AI for good, that is, apply AI for good in healthcare. And we've already received about 60, 70 applications. We're doing this in collaboration with MIT Solve. And we expect many more applications to be submitted over the course of the next few weeks. The deadline is October 30th. And we're going to select winners, and the winners get seed money for their idea to explore them. And they also get 1-year residency across the hallway here at Cure's collaboration residency. So that's plus access to our ecosystem, mentorship, introductions to people who would help bring their ideas forward, etc. So please spread the word, and if you know anybody who would be good to apply for this, please encourage them to apply. So in any case, I hope you had a good overview of what Cure is all about, our mission, our vision, and our facility, and enjoy it while you're here. And thank you again. Appreciate the collaboration.